How about you back there? Ready? Great. Well, thank you all so much for coming today. We want to go through some numbers with you. I want to first start off. I've just received word that the governor has changed his mind on statewide masking policy. We do appreciate that. As you know, that was one of the things that the doctors asked me to ask for, and very briefly I'll go through that with you. This will go into effect tonight at, I believe, I'm sorry, it actually is already in effect, according to this, and, or no, I'm sorry, I'm incorrect. It goes into effect at 12:01 p.m. on July the 3rd, so that's tomorrow, right? And it requires that you wear a mask when you are indoors or when you're outdoors and you can't be 6 feet away from people not in your family unit. The first time you fail to do that, you'll get a warning. The second time, you could receive a fine of up to $250. Here in Dallas County, we will endeavor to enforce that in the way that we have with the businesses. We already have, of course, a mask ordinance here. So what's the difference in the mask ordinance we have here today and the mask ordinance that the governor put into place? Well, in the mask ordinance that the governor put into place, you're also required to wear that mask outside if you can't stay 6 feet away from others. It has all of the same not opt-outs, but exceptions like eating food, you have a medical condition, you're driving alone in your car, that we put in ours. And so that will be in place, and it's very good. We're very glad that happened, and I want to thank all the doctors and business people who pushed so hard for that to happen, because now that will be a regional and statewide approach, and that really should help us with what we're seeing, because what we're seeing, folks, is pretty scary. It took us 92 days to get to 300 cases a day. It took us 22 more days to add 400 and get to 700 cases, which is where we are today. A couple of other things while I'm saying our appreciation of the governor for listening. There were some other things that he did this week in response to the letter. They loosened the unemployment rules so that I think it was starting next week, you were going to have to go search for work if you were unemployed, even in the middle of this pandemic, and that's been loosened, and that was the right thing. We appreciate that. They did put back into place the rules for daycare centers that we requested. We appreciate that. And of course, we're just seeing the order, but it appears to backdoor answer a lot of the questions that the doctors had about places like, for instance, cigar bars, where you're not eating or drinking, but it's just not possible for you to wear your mask all the time, or a place with an incredible amount of indoor exertion where you are not able to wear your mask all the time. And it appears that those would not be allowed under the governor's order, and hopefully we'll have more clarity on that as the evening goes on. Things that weren't done in the order, but I want you to really strongly consider doing it, that the doctors asked for. They asked that bowling alleys, arcades, concerts, movie theaters, maybe gyms where you can't wear your mask were closed, but we'll see. Group youth sports where you breathe all over each other, public pools, day camps, and other social venues or activities that do not allow strict physical distancing and masks to be worn all the time be closed. Now, all those were not closed, but I want to encourage you, don't go there. In the middle of this pandemic that is obviously completely out of control now, please don't go there. So let's talk about the weekend. And we got a big holiday weekend coming up, and that's really the most important thing for us to talk about today. When we put Safer at Home in place, it did have an effect. The doctor said it began to have some effect within a few weeks on the rise, but we didn't actually see the numbers go down, that curve flattening go down for 2 months. And when the governor did the Open Texas, took away those requirements, opened some businesses, we didn't see the numbers go up appreciably for about 5 weeks. Do you know the only 2 times that we've seen the numbers move within a month in a big way? The answer to that question would be Easter Passover. 14 days later, we saw a big jump. And Memorial Day, 11 days later, we saw a big jump. What happened? What happened is 28 million Texans and 7.6 million North Texans celebrated Memorial Day. And they got together and they let their guards down. They saw some extended family. They did the sort of things that we do for holidays. Unfortunately, this holiday, and Phil will talk about this more, and this really stinks, and I hate even saying it, but what the doctors are asking is that you find a way to celebrate this July 4th with only your people that you are around daily, your family, your roommate, because things are out of control, and we saw that huge jump after Memorial Day and after Passover, Easter, and we cannot afford it. Our hospitals, our economy can't afford it. If we let our guard down this weekend, we can set our economy back by months. We can have a lot more people sick and a lot more people die. So it's really up to all of us. Keep those celebrations super small. And when you are around anybody else, wear your mask. Anybody outside that home that you're with every day. We saw, by the way, our hospitalizations last month not only double, but go up 125% here in Dallas, 140% across the region, and that is not sustainable. If we keep doubling like this, and those hospitalizations are like these underlying case numbers, okay? Took 92 days to get to 300, and another 22 days to get to 700. And so it's not necessarily true that it took just because it took nearly a month to double last month, it'll take nearly a month to double this month, particularly if we don't really guard ourselves this weekend. It had not made a move like that even over the last 4 or 5 months before then. So this is very, very, very important. So we're asking you not to go to large events, to stay home as much as possible, to always distance at 6 feet, and to importantly to wear that mask. Let's talk a little bit before I turn over to Phil about our testing sites. Tomorrow is a holiday for most people, but you're off from work, but our test sites are open. Okay, so the test sites are open tomorrow. Now, let me explain a couple of differences in the test sites and why that is. Okay, so the AAC has closed, and it's been replaced by the University of Dallas. If you're a Cowboys fan of a certain age, it's right by the old Texas Stadium site. That is not federal testing. That is locally paid for by the City of Dallas and the County of Dallas, and therefore we don't have to go to the federal test site that I'm beginning to think is on the North Pole, and it must be accessed by very slow reindeer because it's taken us about 10 days to get the test turned around, okay? And so at this new site, it's our hope that similar to people who have insurance, you're going to be able to get your test turned around in 2 or 3 days. And that's very, very important, frankly, because it's hard for you to make your best medical decisions, and there's an 8 to 10 day turnaround for your test. And it's hard for us to trace those who you've been in contact with and help keep them safe if we don't know what's going on for 8 to 10 days. There are 1,000 tests at Ellis Davis Fieldhouse. Those tests, unfortunately, as well as our walk-up sites, are the tests that are still taking 8 to 10 days. Know that we are working hard, And part of the reason I'm telling you about it today is because I'm hopeful that a lot of members of Congress and others will see it. We are working hard to shrink that time that it takes for them to turn around those tests. One way to do that, and we've been asking the governor and the feds this for 2 months now, is to not send the stuff off to your federal lab, wherever that is, but just to give us the reagents, the chemical that runs those tests. We've already bought the equipment at UT Southwestern in Parkland. Let us do it ourselves. We can turn these things around in 2 or 3 days. Or if you want to keep doing tests, we use all the help we can get, but get us the reagents so we can get our people tested in a timely way. Those tests are available, and we're working every day to try to get the turnaround time faster for you. Also, here's a big difference, important thing for you to know about the site in Irving, the University of Dallas site. Since that is paid for not by the federal government, but by your tax dollars as either your Dallas County tax dollars or CARES Act funds, or your City of Dallas tax dollars or CARES Act fund, that is only available to people who live within the County of Dallas in any city, Dallas or any other city, or there are a few people who live in the unincorporated areas. If you live in Dallas County, you can get a test there, but you have to have some proof that you live in Dallas County to get a test there. You do not need a picture ID, a utility bill, a library card, almost anything will work, but bring some piece of paper that indicates that you actually live here to get a test there. Also, those sites are getting clogged up very quickly. The federal sites, one of the other challenges with the federal sites is they won't allow us to have any appointments there. It's just first come, first served. So people are showing up at 5 o'clock in the morning, lining up, and we're usually running out of tests sometime in the afternoon or late morning. So if you do want to test at one of these sites, I suggest that you get there early on that. Look, this is obviously not where we wanted to be, okay, in July. It's beyond frustrating that we are where we are. But the important thing for us to focus on now is, frankly, is not how we got here at this point, but how we're going to get out of this. And we will get through this. You know, I keep saying this, but we will get through this. This masking, these doctors are saying that this masking is the single most important thing that we can do to protect one another. All right, we're going to do that. We're going to make those good, smart decisions. Moms, whoever is the head of the family there, making those decisions for the weekend. We're going to make good, smart decisions. You can get that information, by the way, at DallasCountyCovid.org. You can get a color chart of what the governor has opened and whether or not the doctors think it's safe for you to participate. It's in both English and Spanish, but we will get through it. Let's not get mad at one another. Let's not, let's show grace to one another. Let's show grace to those people who, for whatever reason, are not wearing their mask. Nicely remind them, but don't go off on them. Because, it's a scary time, and we need to show grace to one another. But we will get through it if we all move from selfishness to sacrifice. It's a big sacrifice that I'm asking you for. I know you've got traditions on the 4th of July, and I'm asking you to put those aside and be sacrificial and stay home with just the people you're around every day, so that we have our best chance of this not getting a lot worse 2 weeks from now. Thank you, and here's Phil Wong.
So as the judge mentioned, today we're reporting 708 new cases, which brings our total number of case counts to 22,590. We're also reporting 7 deaths, which brings our total number of deaths to 387 deaths. Now, on the way over here, I did get a text sort of with a preview for our count for tomorrow, and we will be reporting over 1,000 new cases tomorrow, which is absolutely the highest we've ever reported. And again, we keep having every day as a record number of new cases. I do want to, again, go through the monitoring data regarding this. Well, actually, before we go, yeah, okay. So this is, we still, again, we've been still at the stay home, stay safe red zone in our risk level. And next slide. This is the number of emergency department visits in the last 24 hours in Dallas County. You can see yesterday was a record number. Today is a little lower, but certainly this whole trend is going up. Next slide. This is the available ICU beds. Went up just a little bit the last couple of days, but then it's back down. Actually, the last few days, it was starting that we were having a few more available beds earlier this week, but then it's been going down now last couple of days. Next slide. The general hospital admissions in the last 24 hours. Again, yesterday was a record number. Today is lower, but still part of that increasing trend that we've been seeing. Next slide. This is the ICU admissions, and you can see again that increasing trend in the last few days. Next slide. And this is the census for the general hospitalizations, the number of beds that we have for general hospitalizations. Yesterday was a record number, today a little lower, but again, still that increasing trend that we've been seeing in this. Next slide. This is the ICU hospitalizations. Again, yesterday was about equal, at least, to the highest number we'd seen in ICU hospital beds being used. Today a little down, but again, this trend is still way up there. And I think the last slide is the number of deaths by the actual date of death. You can see the last, we have more of a lag in some of the reporting of it, but you can see the last couple days where we have more confidence in the numbers certainly increasing and getting to some of the high range numbers. One thing with these numbers, again, we're seeing just remarkable increases that we really think, as the judge mentioned, a lot of this latest trend upward has been timed since Memorial Day. When we really started, there was a lot of opening up of different things. I think simultaneously everyone thought things are open, now we can go back to normal, and people sort of let their guard down. And now 3-4 weeks out, this is where we're seeing the effects of that. And one of the messages that we had from our hospital, the modelers that are looking at the projections and what our hospital capacity is, really emphasizing, as the judge mentioned, we cannot have another Memorial Day over this July 4th weekend. If that happens, it will really be catastrophic. The current trends, if we keep going up that rate, we can get in a couple weeks to our surge levels in the hospital, which are getting where we're starting to really reach capacity. But it was just absolutely, we cannot have another weekend like we had over Memorial Day over the July 4th weekend. And that's why everything the judge was mentioning is so important. The mask, the cloth facial coverings, the universal use of that is going to be so important. And we're very thankful that there's the new orders from the governor on this. It is, one of the key things for us to be able to open up safely. Just a few things other. I want to mention that DCHHS did begin accepting applications for our emergency housing assistance program yesterday. This provides short-term rental, mortgage, and utility assistance to low-income Dallas County residents that live outside of the city of Dallas who've been economically impacted through loss or reduction of income as a result of COVID-19. That you can apply online or over the phone, and you can get the details off the Dallas County Health and Human Services website. Applications will be accepted till next Thursday, July 9th at 4 p.m. And so, the applications will be processed in a lottery system. So anyone who gets their application in between now and next Thursday at 4 p.m. Is eligible, and then they'll be selected through a lottery system. So that does allow there's no advantage if someone has faster internet. If you have to use a phone to access it, you're not at a disadvantage. Everyone who gets in during that time will be in the lottery system to be available. Applications are available in English and Spanish, and the length of assistance is maxed out at 3 months. But we hope everyone that needs that will be able to take advantage of that. Again, just the final reminder, reiterate, we cannot have another Memorial Day over July 4th weekend. And please use your masks, do the 6-foot physical distancing, stay in, keep with your close family, household family members, and stay safe. Thank you.
Dr. Wong, on the 1,000 cases, I know you said you just got a text, so you maybe don't know. Is there anything that's leading to that? Was there like a influx in more testing, a lag in certain tests being examined, or lab results coming in that led to that big, really big jump?
Nothing that I've seen. Again, I just got this on the way in. Oh, the question was, with the projected 1,000 tests that we'll be reporting tomorrow, is there anything in particular that might account for that, a big bolus of new tests reported? We don't have an indication of that now. Again, all the increases that we've been seeing over the last week and a half so have been really, we think, just general increases, again, timed to what was going on after Memorial Day and after, and just all that relaxation, all the things opening up, everyone just not being as safe, not using the cloth facial coverings as well, not teleworking as much, not staying home.
And a quick follow-up to that, I saw, we get a lot of reaction on social media from people who see the numbers and say, well, is that just because hospitals are testing everyone for COVID and people going in for other things are testing positive, even if they're not really showing COVID symptoms? Can you speak to that? Are you seeing any that as a reason for the numbers going up?
Well, one thing in terms of, the question was, again, interpreting that, some people are saying that is because hospitals are doing more testing or others are doing more testing. One of the things in our detailed reports that come out on Tuesdays and Fridays, we report, that is one where we report the percent positive of the hospital tests that are conducted. And one of the things, there are variations that occur in that hospitals, some of them have been changing their policies so that everyone who's going to get any surgery pre-op, they get a test. Any pregnant woman who comes in to deliver their baby gets a test. Initially, those asymptomatic persons that were getting the pre-ops, they were like less than 1% positives. I know we've heard from the hospitals, those asymptomatic pre-ops have actually been increasing to 3% or so. And the other persons now that are in the hospital were getting, I think the latest report was like 23% positive, which was a lot higher than it has been. What that's one indicator, the percent positive, we've said it's dependent on a lot of different factors, who's being tested, what's being done. The hospitals are a little more consistent, although they were changing some of their policies. But now that that's leveled out, seeing that dramatic increase in the hospital percent positives certainly indicates there's more disease out in the community. I think all of this is just reflecting that broad increase in community spread, that it's really out there.
Dr. Wong, in your opinion, would a statewide mask ordinance prevent the need for another stay-at-home or safer-at-home policy?
And I know the judge's recommendations that came from, the Public Health Committee recommendations were really that, we go back and step back for 30 days, but not all the way back, but, and based on some of the things that we had seen were working. And so it was, specific, the universal masking, the 6-foot physical distancing, and as the judge mentioned, some other things, some specific places closing, like the bars, like has already been closed, gyms, and the places where you really can't safely do the physical distancing. But that, if everyone did universally mask, and again, the question was, if you had universal masking, would that prevent having to go all the way back to stay home, stay safe, and shelter in place, I think was the concept. So that we've said, we really need to pull back for 30 days, backtrack on some other things, like the bars closing. We were recommending restaurants, don't go indoor dining, keep to the takeout, or even maybe some outdoor dining if you can do the physical distancing. And the masking will be helpful, a key part to allowing all this to move the numbers down. I mean, if we can get all of that and get the numbers down back to a manageable level, then that's where we've always said that we could start opening things back up. The masking is one of the key pieces that we've said the evidence and science are showing. If everyone did that, then it really makes so many different settings more safe, and hopefully, again, prevent further backtracking, prevent further certainly having to go all the way to shelter in place. Yeah.
Doctor, I know you can't predict the future, but do you see this trend going up for some more time, even after everyone does what they're supposed to do and what you guys are asking us to do?
You know what,
Before it goes back down?
the question was, do we see this trend continuing through the summer, even if everyone does what they're supposed to do and wears a mask? I mean, we've seen, and we were successful in slowing this down, in flattening the curve when everyone does what what we're recommending and what we know will prevent infection. If everyone does this, we think that the numbers will go down, and because we've seen it worked before. But it takes everyone working together and being really vigilant, and that's what we're hoping that we'll see that decline. And so, but it's dependent on everyone really doing it and being compliant with this. So we would, if everyone does this, we think the numbers will go down. And we're monitoring, we're reporting them every day, and there's no reason it shouldn't if people are really doing what we know works.
Judge, quick
Doc-
question for you.
Oh.
Sorry.
Can I ask a question while he's still up there? One of the reasons that people say that they aren't necessarily following the recommendations is because there is some confusion or even skepticism about the numbers that are being reported. People say that the increase may still be due to sort of an increase in testing or a change in definition of what constitutes a case. There's a lot of sort of things that are being put out there in the public, social media. Are there any outside factors like those that may be affecting the count? And what is the county doing, if anything, to sort of combat the confusion and misinformation that's out there that's leading people to believe these numbers aren't actually reflective of what's happening?
So the question was that there are a lot of people who are skeptical of this or say that the numbers are dependent on testing or changes in the definitions and other reasons, and so they're skeptical about our numbers. And this is why exactly the indicators that our Public Health Committee has recommended are those numbers that are less dependent on how much testing is going on, who's being tested, those sorts of things, because in primarily the hospitalization numbers, no matter if they were tested or not, if they have infection and they get severely ill enough to go to the hospital and be admitted, that happens whether they were tested or not. It's sort of that course of illness in the population. Same with the ICU admissions, same with the new admissions, the census counts. Those are some of the key indicators that we've been looking at. But then we're also looking at other indicators and keeping them in context. But these are the ones that we've said are less dependent on testing, and that's why we've been reporting them, we're monitoring them. We think they're the most stable. And so if there's any skepticism about the numbers, there are some now changes in terms of how do you interpret the antibody tests as opposed to just the RNA tests. And so there is something, this might be getting into the weeds too much, there's a confirmed COVID-19 test, and then if you use these other tests, they can be considered probable. We have not added probables to any of our case counts. Our case counts are the same definition that we've been using. We've been using confirmed cases, so that has not changed. These numbers don't reflect any change in those definitions.
Does the county have any information on the blitz testing that we've heard will affect young people from the federal government?
I did hear from the State Health Department this afternoon to get a little more information. It sounds like it's this initiative. They're going to do like 5,000 tests in a short period of time. My understanding, there are two communities that are getting it. I think McAllen is currently getting it. They may have started today, and maybe El Paso was the other community that was going to get that blitz testing on young adults. They were trying to get again, focus on particular medium-sized communities or something that might have high-risk populations. That was, and that's all I've heard. I think it's national. I think those are the only two that we know of in Texas. I heard maybe Seattle, Washington was another place that was getting it. But.
Judge, have you been able to, I asked you this last week, talk to the governor? Dallas County is one of the ones that have big amount of cases compared to other counties in the state. Has Abbott spoken with you, asking you what the county needs, or other than the letter that you sent to him? How has that communication been?
And so the question is, has Governor Abbott spoken to me since the letter? No, he has not spoken to me since the letter. We've communicated mostly with his chief of staff, and then we're communicating, I guess, through you in a sense with what needs to happen. And you know, look, on the question, going back to the question on skepticism, the governor has changed his mind. I would encourage, and the reason he's done that, it hadn't been easy for him, but he changed his mind because of the numbers and the science. So for people who thought this was a hoax last month, or you thought that the reason these numbers went up was because of testing, that doesn't explain why there's so many people in the hospital. It doesn't explain why 20 people died 2 days ago. It doesn't explain why a 20-year-old woman with no underlying health conditions and a 50-year-old man with no underlying health conditions were among the COVID deaths for yesterday. It doesn't matter what your politics are. The virus doesn't care who you vote for. The virus is just unrelenting, looking for a host to infect. And even if you don't die, it's a very bad disease to get. We've got young people on ventilators. You don't want this. Please take it very, very seriously. I do have one piece of news that happened while I was sitting listening to Phil. We were able to reach an agreement. So the governor did not agree to a moratorium on evictions as requested in my letter. Now, the top of that letter that I sent last week, by the way, everything in there except for the economic things were from the doctors. The loosening of unemployment benefits, the moratorium on evictions, and the freezing of the top of taxes, those are requests that I made. They're not medical. However, the justice of the peace who hear the evictions have agreed today, after meeting with me and at my urging and after give and take, that effective, well, pretty much immediately, because the courthouse is closed, won't be opening again until Monday. They won't be taking any new filings for evictions until I believe it's August 5th. Now, the filings that are already there will be handled by the judges on a case-by-case, or a judge-by-judge basis. There are judges who see this number of COVIDs that we're having and decided not to proceed with those cases, and there are judges who have decided to proceed with some of the cases, and judges that have decided to proceed with all of the cases. They're independently elected. They get to make those decisions. I do also want to point out on the eviction moratorium, this is for non-payment of rent. People can still be evicted for family violence or criminal activity or those sort of actions, but not for non-payment of residential rent in July until the first week of August.
Can you talk about, TABC has said it has heard about bars across the state that are planning to blatantly, willfully defy the governor's orders and open for the 4th of July. TABC said it's going to be out there doing some enforcement. What are your thoughts on this? And is Dallas County in any way, are you aware of any here in Dallas County, and is Dallas County going to plan any enforcement if it becomes aware of this happening?
So the question is about rumors that bars are planning to open for 4th of July in defiance of the governor's order that they be closed, and what, if anything, is Dallas County going to do? So I am in communication with industry leaders. I think y'all have kind of seen this. I prefer to have a direct relationship with business and encourage compliance rather than sending people out to force them to do something. So I am talking to liquor distributors. They can't be open if they don't have any liquor. And also big bar owners and industry people about that. I'm not aware of anyone, personally, I haven't heard, and the bar owners I'm talking to haven't heard of anyone who would do that. I would just say to that bar owner, please reconsider, because to the extent, and I'm not even saying there's anybody out here who's thinking this, but if the rumors are true, and there are, your 4th of July weekend profits are not as important as public health. And when you see the governor of Texas, who has said all of these things about the most important thing is open Texas, it's safe to open the bars, all the things that he said, turn around and say, close the bars. He didn't do that on a whim. He did that because the overwhelming evidence was that, unfortunately, and there's nothing wrong with you, but unfortunately, the reality is that the bars were a big cause of spread. It was obvious to the doctors who were looking at it, and so he closed those bars. So here's an area where the governor and I are very much in agreement. Do not open your bar. We're all going to work together to make sure that that does not happen. I think our business owners, though, are really conscientious and good. I talked to the head of 2 associations last night who called my cell phone, and I think they're working their best to keep you safe, and we won't have that problem. Yes, sir.
Judge, apparently part of the governor's order gives county judges and mayors the ability to enact actions on outdoor gatherings, groups of 10 or more. Have you spoken to the mayor about that, or what does it look like if you're gonna?
No. What I would do on that is, first thing I'll do is I'll ask the Public Health Committee, which is made up of medical experts, not chosen by me, but chosen because they are the chiefs of epidemiology, infectious disease, they're CEOs of the public hospitals, et cetera, to work with Dr. Huang and advise me. They've already advised that on indoor groups, they should be limited to 10. Now, outdoor groups are less of a risk, so we'll look at what their advice. I made my piece early on. I'm not trying to, quote unquote, figure this out. I'm listening to the doctors. This is it's a public health emergency, so it's like we're all sick, and we need to take our doctor's advice.
You mentioned the evidence on the bars being from contact tracers. Are contact tracers asking about that specifically, and are people saying they were at a bar? And what is this evidence, and how are we coming to the conclusion that bars definitely contributed?
Oh, okay. So the question is, what is the evidence? Now you're asking a non-epidemiologist, a medical question. But what is the evidence that the bars definitely contributed? And I guess it's DISHIS that has that information. Phil, do you have?
Yeah, it's probably statewide
Yeah.
information. I mean, ours is not specific. I mean, there's a lot of exposures that,
And when I said DISHIS stands for the Department of State Health Services, a state agency that did the study. Any other questions about any other things? If not, thank you all so much. And please, all of you have a very safe 4th. But, please don't go to crowded places this 4th, and wear your mask.